Good evening, all the aspirants present here. So the debriefing session will be taken by Dr. Suvadeep Sen. Sir, you may take over. Thank you.
Yes, thank you so much. So, hello everybody, I am Dr. Suvadeep. I work in Apollo in Navi Mumbai. So today I have taken up mock examination for. So without much delay, let's start today's session. So let me just see that who were there at the time of the examination. Dr. Asif, I think he was there.
Yes, sir, have joined us too.
Okay, Dr. Dr. Raga.
Yes, sir.
Okay, sure. So anyway, all of you, whoever has given mock exam to me, so we have practiced one clinical case scenario and few case-based scenario. So we'll discuss the clinical case scenario, and I'm not giving anybody definite feedback, direct feedback, but what we can discuss today, we can discuss how to give answer to the particular questions in the exam, how to approach that kind of question. You can listen to the recording and then you can try and correct yourself whenever it is given, wherever it is possible. Okay, so we discussed about one case vignette about a 42-year-old male who was seen by bystanders as he intentionally jumped into an ice-covered lake on a cold December night when outdoor temperature was -6 degrees centigrade. He was recovered from the lake after an attempt for approximately 15 to 20 minutes. He was unresponsive. A bystander chest compression was initiated and call for nearby hospital was given. ER team arrived. You were the part of the ER team, and they initiated the CPR as per the ACLS protocol. Initial rhythm detected was asystole. CPR was continued, and the patient was brought to the hospital with ongoing CPR. He was called for help during resuscitation. So that was the case vignette that was been provided. With that, we built up the multiple questions. The first few questions are there. It's purely on resuscitation of this kind of patient. So what are the practical challenges in the resuscitation of the patient? How will you overcome the challenges? What are the salient points in the resuscitation protocol in hypothermic patients? And what are the prognostic factors in determining overall outcome in a post-drowning hypothermic out of hospital cardiac arrest?
Sir, please can you again repeat the first slide?
Repeat the first slide. Okay. So first in the first slide we talked about a one case vignette. Somebody got drowned in a lake, and the temperature was hypothermic. So she was brought by somebody, and then we initiated the resuscitation protocol. The question was what are the practical challenges in the resuscitation of this patient? So in the EDIC kind of exam, so which is
not clear, sir.
Which is an European diploma exam. So we'll expect this kind of challenging questions, and where you are required to know the CPR protocol in depth.
Voice is not okay. Voice is not clear at all. Voice is not clear.
Is it for everybody or it is for someone?
Mohammed Raga, please do check your connections.
Yeah.
The voice is audible.
Voice is audible. No? If it is for one particular doctor, please check your internet connection once, because I understand. Or you will get a recording. Most probably, you can listen to that thing later as well. And you can send me your queries if you have any in the later part as well. So now coming to the discussion of this kind of patients. Now, what are the practical challenges? So I have taken example 3 of yours, you candidate. So whomever have, I think one candidate has given a very good response to all of the questions. But the thing that we lacked over here is that the answers are not very to the point, and the brief and the to the point that are expected to have. So now, if somebody asks what are the practical challenges in resuscitation of the patient, the three practical challenges. Number one, first is it is an out of hospital cardiac arrest. That is one challenge. Second, it is a resuscitation after drowning. That is second challenge. And third thing, it is resuscitation in a patient who is hypothermic. So there are the three challenges that we are anticipating during resuscitation. So these three challenges you need to address separately. So how will you overcome? So these three challenges you need to know that how will you address these three separate challenges in this particular patient. Now, 1, 2, 3 is a kind of almost same question. So it's a part of the same question. Now, what are the challenges that we anticipate in somebody during resuscitation in a patient who is drowning? Now, whenever we talk about resuscitation on the CPR protocol, we talk about A, B, C, D, E. So that is a kind of very practical way to talk about in any exam or in any practical steps. What are the airway-related problem over here? Somebody who has been drowned, we can expect a lot airway obstruction from water, mud, soil, and all these things. Patient can go in can be in laryngospasm from the drowning, which is because of this vagal response. We can have a cervical spine injury in this kind of patient. So we need to provide protection for the cervical spine. And as most of the patients develop cardiac arrest because of this respiratory arrest, it is better to intubate these patients early with a C-spine protection. So these are the airway related problems. We need to clear the airway initially. We need to try for clearing the airway, do the suctioning, and then we need to secure the airway as soon as possible. That is the airway related problem. And what is breathing related problem? Going to the B part. Breathing means these patients have a respiratory arrest. So most of the time, somebody who has developed respiratory arrest followed by cardiac arrest, it is imperative to start the ventilation the earliest. So we need to intubate this patient, secure the airway, and put them on a positive pressure ventilation. Now, most of the patients, a lot of patients that drowning, they develop a non-cardiogenic pulmonary edema. Their lungs are filled with a lot of water. So initially, we need to give 100% of oxygen. We need to continue. We need to talk about lung protective ventilation. We need to talk about to prevent barotrauma. But initially, we need to do an ambu ventilation with 100% of oxygen. So that is how we adjust the breathing. Now coming to the circulation. Circulation, this patient is drowned, so we need to start the effective chest compression as early as possible with 30:2 or whatever the ratio, or 2 minutes. That's highly effective chest compression. So that needs to be initiated as early as possible. Along with that, we talk about the D and E. We see that whether there is some other injuries as well, like this patient might be having some associated injuries like long bone injuries or something like that. Some might be bleeding. So those things need to be taken care of, and we need to prevent the exposure for like hypothermia prevention. So they are all comes in a kind of resuscitation protocol in somebody with a drowning. So that is this is number one.